I hope you've been enjoying the opportunity to connect a bit and have some breakfast. I'm Alice Park, Senior Health Correspondent at Time, and it's my pleasure to welcome you this morning to this session. I'd like to thank our hosts, the WHO, Bloomberg Philanthropies, and Resolve to Save Lives. It's really my pleasure to be moderating this morning's session around the topic of hypertension. We're going to be focusing on looking for ways to turn the growing momentum around diagnosis and the commitment in this space into actions that can help the 1.3 billion people who are currently living with uncontrolled blood pressure. We're going to be hearing about the latest findings from the WHO Global Report on Hypertension, and we'll also be hearing from health leaders from around the world who will share their experiences with successful programs in addressing hypertension. So hopefully by the time we leave here this morning, we will all have some new learnings on how to scale and really bring those successes to more people around the world. To start things off for us, it is my distinct pleasure to introduce Dr. Tedros Ghebreyesus, Director General of the World Health Organization, who will give us an overview on this year's Global Report on Hypertension. Dr. Tedros.
Thank you, Alice. Honorable ministers, I'll be recognizing my minister, Dr. Mekdes, my friend Tom Frieden, Dr. Kelly Henning, distinguished guests, dear colleagues and friends. It's a great honor to launch WHO's second global report on hypertension together with Bloomberg Philanthropies and Resolve to Save Lives. I thank my good friend Mike Bloomberg and Tom Frieden for their leadership and partnership in this area and so many others. Years ago, Tom may remember this, Tom came to WHO for a meeting about hypertension. And I remember vividly an expression he used that caught my attention and has stuck with me ever since. He said that people with hypertension are like walking bombs. They carry a deadly condition that could go off anytime. These are Tom Frieden's words, walking bombs. And every year, it does go off in 11 million people, cutting their lives short and robbing families of someone they love, and economies of billions of dollars in health costs and lost productivity. Imagine that's the entire population of New York City and Chicago combined, wiped out every single year. That's 11 million. No other risk factor or pathogen claims as many lives. Globally, more than 1.4 billion people live with hypertension, including me. I'm one of the lucky ones, of course. My hypertension is well managed with medication. And that's the great paradox of hypertension, that it can be controlled with relatively inexpensive medication. And that has been shown, as you know. But globally, only around 1 in 5 people with hypertension have it under control. In 99 countries, control rates remain below 20%. Millions remain undiagnosed, untreated, or poorly managed. The biggest barrier is access. Access to medicine and access to affordable, validated blood pressure devices. That's the challenge. But it's also the opportunity. Because if we can control hypertension in just half of those affected, we can make a massive difference, preventing 76 million deaths by 2050 and saving $100 billion every year in health costs. This report shows that it can be done. It contains the real-life examples from Bangladesh, the Philippines, and the Republic of Korea. As we will hear today, the Dominican Republic, Ethiopia, India, and Indonesia are also make life-saving progress. The key factors for success are the same across all these countries: political leadership, sustainable financing, community engagement, and integration of hypertension care into universal health coverage. Many have used the WHO Heart's technical package to strengthen primary care, expand team-based services, standardized treatment, and improve access to affordable medicines and devices. Hypertension control is one of the most cost-effective interventions in public health, but it requires leadership and investment. And above all, it requires the conviction that every life matters. As you know, this week we expect world leaders to approve a political declaration on non-communicable diseases and mental health with ambitious targets: 150 million fewer people using tobacco, 150 million more with hypertension under control, and 150 million more with access to mental health care. These targets are a floor, not a ceiling, and countries can and must aim higher. Honorable ministers, dear colleagues, compared with some other persistent challenges in global health, hypertension is low-hanging fruit. We know what the problem is, and we have affordable solutions. So, what's stopping us? Let's confront the challenge, embrace the opportunity, and save lives. The opportunity is before us. The responsibility is ours. And the time is now. I thank you. Thank you.
Thank you, Dr. Tedros. Now I'd like to invite Dr. Kelly Henning, Public Health Program Lead for Bloomberg Philanthropies, who will talk to us a little bit about investing in hypertension control to fast-track progress on non-communicable diseases. Kelly.
Thank you, Alice and Dr. Tedros. Good morning. Good morning, everyone. I'm glad to be here to discuss such an urgent health topic with you. More than 1.4 billion people live with high blood pressure today, and yet only 1 in 5 have it under control. Dr. Tedros mentioned this in his talk, but I think it's worth mentioning by every single speaker over and over and over again. Every year, this silent killer causes millions of preventable strokes, heart attacks, kidney disease, dementia. At Bloomberg Philanthropies, we're committed to working with partners to help prevent as many of these deaths as possible, particularly in low and middle income countries where the burden is so great. Through the Cardiovascular Initiative, a partnership with Resolve to Save Lives, the World Health Organization, and other committed partners, partners with groups on the ground to enroll more than 40 million people thus far in hypertension treatment. We will hear several inspiring country-specific examples from our esteemed panelists today. At Bloomberg Philanthropies, we're proud to support this initiative, whether through advancing treatment for hypertension or complementary work that we support on reducing salt intake and eliminating trans fats. It's clear that progress is possible and is also scalable. But here's the truth. Progress at this scale requires resources. If we are serious about saving lives, strengthening health systems, and reducing the prevalence of NCDs, then we must all strive to back these good intentions and strong programs with financial commitment. So today, I call on you to join us. We know what is needed, we know what works, and we all need to work together to increase the financial obligation to this very, very important health issue. Let's increase funding to detect and effectively treat high blood pressure. Let's invest in this proven, cost-effective, life-saving intervention. And by doing so, we will not only save millions of lives, but also build stronger, more resilient health systems and communities for the future. Thank you.
Thank you, Kelly. I'd now like to welcome Dr. Tom Frieden, President and CEO of Resolve to Save Lives, who will talk to us about how medication is both the biggest barrier and the biggest opportunity in making progress on hypertension control. Tom.
Good morning. Thank you very much for being here. Thanks to our co-sponsors, thanks to WHO, Bloomberg Philanthropies, all of our panelists. If we can have the first slide, or maybe I advance it. Yes. I want to introduce you to a man I met earlier this year in northern India, where the government is expanding a very effective program to treat hypertension. His name is Jagannath. And he came to the health center, this is a rural health post, because his back hurt. And he wanted to get something to help him with his back pain. But because that center is part of the World Health Organization HEARTS program and ensures that each person attending a health facility has their blood pressure measured, his blood pressure was measured. And I don't know if you can see it in the background. It was 182/91, confirmed on multiple occasions. So he had severe hypertension, severe high blood pressure, undiagnosed, untreated, and asymptomatic. High blood pressure is like a battering ram. With every heartbeat, every second of every day, the blood is slamming against the brain, heart, and kidneys, and increasing the risk of a heart attack and stroke. And often the first symptom is a heart attack or a stroke, at least a third of which are fatal. But because this program was in this facility, he was immediately started on treatment, appropriate treatment, as good as anyone in the world could get. He was enrolled in the treatment program so that he would be followed up over time. He was connected with the nursing and clinical staff and medical supervisors who would support him. And I don't know who was happier, him or me. 50 million lives are in the balance. That's the difference in lives saved between our current status of at most 20% controlled and 50% controlled. As Dr. Tedros said, that would be saving, well, 76 million lives in the next 25 years. And it's not just lives, it's also disability. Current estimates are that 1 out of 6 patients with dementia, that dementia is due to uncontrolled blood pressure, whether it's multi-infarct dementia or Alzheimer's disease. Now, there's good news and bad news. There's, in fact, 2 pairs of good news and bad news. The good news is that NCD work didn't lose any money with the recent budget cuts. The bad news is that's because it didn't have any money to lose. The second piece of good news is that it only costs $5 a year to treat a patient with the best medications in the world, not second-class medicines, the same medicines I use to treat my hypertension. The bad news is, because it only costs $5 a year, there's not much money in it for pharma. So there's no real economic incentive to scale this up. Treatment with low-cost generic medications is highly effective and highly safe. I want to tell you the story of South Korea. South Korea shows what's possible. Just 25 years ago, their global control wasn't their hypertension control. This is community-based. This is gold standard studies in the community, was 15%, not very different from the global average of 9%. Globally, we've been a laggard. We're only at 20% globally. They're at, it says actually 58%. They're at 62% this year in the latest unpublished data. This is with a focus on control. The clear lesson is focus on control makes an enormous difference. And with that, they've seen an 80% decline in cardiovascular deaths. Look back to 1990, and you can see Korea in blue, really kind of global average, not very different, a little bit better. And then over the last 30 years, a dramatic decrease, much faster than in other areas. Now, I also want to emphasize that it's not just about treatment. Prevention is very important as well. And really, the 2 most important prevention strategies are represented in this room. One, the Pan American Health Organization in Latin America has been the absolute leader in what is truly the only effective front-of-pack nutrition policy with good evidence, which is a stop sign, black stop sign-like warning saying too much sodium, too much fat, too much sugar. It's very clear that this kind of warning informs and empowers consumers and incentivizes companies to improve both the options and choices. The second, we have the George Institute here, which has really led the studies that have shown that potassium-enriched low-sodium salts save lives. They're a very effective intervention for everyone other than people with severe kidney disease. They're safe and effective. And if you think about it, among adults, at least in this country, and probably in most countries, our most important nutritional deficiency is potassium. Our most important nutritional deficiency is potassium. It's killing more people than any other nutritional deficiency. And elevating the potassium intake above sodium intake is the strongest predictor of heart health. So this is a call to action. Please look at the QR code, sign up, join us, scale up hypertension treatment in primary health care, adopt national protocols, provide free, ideally, or highly subsidized medications. We know that any co-payment undermines adherence, so please sign up. And the last thought to leave you with is that hypertension treatment is affordable. In fact, for the future of families, of communities, and of healthcare financing, we can't afford not to provide free and accessible treatment of high blood pressure. Thank you.
Thank you, Tom. And finally, I'd like to invite Leanne Riley, Unit Head for Surveillance, Monitoring, and Reporting at the World Health Organization, to provide more details on the findings and recommendations of the second global report on hypertension.
Thank you very much, Alice. Thank you, colleagues. Gosh, this is a hard act to follow, so talk about raising my blood pressure. It gives me great pleasure to present the report to you. This report, as you've heard, comes at a really pivotal moment. Hypertension remains one of the greatest health challenges of our time, but it's also one of those biggest opportunities. So I'll be walking you through the key findings of the report, the country experiences, and the recommendations. If I can get the slides to work. Yes. So let me start with why this report matters, because as we've heard, we need to all keep saying this. The current report outlines the situation and shows that 1.4 billion adults live with hypertension, and yet less than a quarter of them have it under control. So every second, lives are being cut short by uncontrolled blood pressure. And despite this being highly preventable and treatable, it remains the leading driver of heart disease and stroke. So the human and economic cost is just immense, and particularly in low and middle income countries. And I think this is a very strong message that we see in the report, just how much the price tag on this untreated condition is. So our report also outlines the urgency. These control rates are dangerously low, as we've heard, and only a really small handful of countries, in fact 4, have control rates that are over the 50% that was presented in the last picture. So this is, of course, a very sobering picture. Nearly every country is far behind on hypertension control. And as the report shows, 99 countries have their control rates at less than 20%. So unless urgent action is taken, more than 1.5 billion people will live with hypertension by 2030. That's just 5 years away. And as we've heard, this puts unbearable pressure on families, on communities, and on our health systems because of these costs. Yet progress is possible, and countries are showing the way. As we heard from Dr. Frieden, Korea is a leader, the Philippines, Bangladesh, they're all showing us that with political leadership, with financing, and by integrating hypertension into universal health coverage, real change is achievable. And these countries are turning policy into results and offering roadmaps for what other countries could follow. And that's documented in this report. The report also focuses on where we see these important barriers and gaps and outlines these. Most countries, sadly, are losing patients at every step of the hypertension care pathway. So from prevention and diagnosis to treatment and follow-up, there are gaps, critical gaps in medicines, in health workforce, and our health systems, which are holding back progress. The report also explores the importance of medicines access. Access to affordable and quality-assured medicines are at the heart of hypertension control. But in too many countries, patients are facing empty shelves and unaffordable prices. So fixing the medicines value chain is critical to saving those lives. The report also makes it explicit that hypertension isn't just an NCD issue. It really is at the cornerstone of universal health coverage. Countries that integrate hypertension services into their UHC benefit packages can strengthen equity, can increase this financial protection, and can shore up broader health system resilience. The report concludes with 5 very clear recommendations, and these are practical, evidence-based, and proven to work. If countries act now, they can rapidly accelerate progress. And these 5 focus on integrating hypertension interventions into UHC and UHC reforms, ensuring access to affordable medicines and validated devices, strengthening the health workforce and promoting team-based care, raising public awareness about hypertension, making it everyone's business, and reducing that number of silent bombs that Dr. Tedros mentioned, the huge amount of people who are unaware that they have this condition. And lastly, but by no means least, strengthening monitoring and information systems so that we can track the progress, but also course correct when we are not on track. So the prize is enormous, and the potential lives saved is also huge. The billions in healthcare costs that could be avoided, and this faster progress towards the SDG goal 3.4 to reduce premature mortality. There are very few other global health interventions that could offer such a powerful return. And finally, our report is a call to action. Hypertension is a silent killer, but it doesn't have to be. Countries already know what works. We're going to hear a bit more about that. But now is this time to turn the evidence into action. Thank you.
Thank you, Leanne, and thanks to all of our presenters. I think that really sets an excellent foundation for our upcoming discussion. So I'd like to invite our panelists to the stage. Dr. Mekdes Daba, Minister of Health for the Federal Republic of Ethiopia. Dr. Víctor Atallah Lajam, Minister of Public Health and Social Assistance for the Dominican Republic. Dr. Gloria Balboa, Assistant Secretary in the Department of Health in the Philippines. And Mrs. Murti Utami, Acting Director General for Disease Control for Indonesia. Welcome, everyone, and thank you for being here. I'd like to just start the discussion with you, Mekdes. Ethiopia was one of the first countries to really adopt the WHO HEARTS program with Resolve to Save Lives. Tell me a little bit about how the government now is envisioning scaling up that program and really, making it a foundation of healthcare in the country.
Thank you very much, Alison. Thank you, everyone. And it's always a pleasure to see colleagues. Thank you, Tom. Thank you, of course, Director General Tedros was with us. And it was always a pleasure to hear from those who are living with something, and especially hypertension. For us, when we started with Resolve to Save Life and with the HEARTS initiative from WHO, what we have started to identify is how many people do we have. So it all starts with understanding the burden and ensuring that you first give a priority to control. So back then when we started, we only have less than 2%. You have seen the global average, less than 2% of communities were having a BP control of, the expected blood pressure control. But afterwards, we have doubled, but imagine, it's just a doubling number. And whatever you double, it all depends on where you were at the base. So recognizing the problem was the most important thing for us, and it became a global agenda. And then for us, it is a national agenda, where the national priority also sets non-communicable disease, which accounts for 25% of our national health account, where we spend a lot, and most of it is around non-communicable diseases. It is like a dual burden now with communicable diseases, and then now we have non-communicable diseases. And for a country to prioritize which one is the most difficult one, especially when you really want to work around global health security, to work around prevention of infectious diseases, and now an additional one is coming. So what we have done and what we have started to prioritize is what innovative ways can we do to ensure that this is based in primary health care and rather than investing on the treatment side, how can we protect our community from the preventive sides, and we help our hypertensive patients? So we incorporated two things. One is to add this in our guidelines and protocols. So the first thing that we have reviewed was reviewing our protocol. When we started, we had 42 wearadas. This is the lower level, primary healthcare levels. And then we now increased to 462 wearadas, 462 facilities who are using this app. And we started with digitalization that would help us in ensuring that we have innovation, not just in papers, but bringing them closer to the community. And another thing that we are also targeting now is about increasing access to safe drugs. Because one of the challenges is about the quality. You want to incur, I agree with Tom, presenting earlier around the cost, which is like $5 per year. But it's not the same when you go to the countries with low and middle income countries, because rather than the cost also, another big challenge that would come is about ensuring that your patients are getting the right and the quality drugs. So we have incorporated our guidelines. We reviewed our national treatment guideline, and both for infectious and non-infectious diseases. And our key priority now is to have local manufacturing capacity. Because it is a big agenda at a national level, but also at a regional level. But how do we have a pool procurement mechanism where the region, the African region, and our country particularly, with the second largest population, can get access to patients with hypertension ahead of time so that we don't invest on treatment? We have a lot of cases with complication that we need to treat, and you can imagine the cost for us. So all the data are presented earlier, but I would say our priority is from prevention, where the government is now working on healthy corridors, changing lifestyle approach, and we do a mass gathering, a mass sport, so that everyone understands that the prevention aspect is very important. But for those who already have it, with a control less than 20%, for us around, even you have heard the number, around 4% control, there is a lot to do, and we have to expedite our approach. Thank you.
Thank you. I think it's always great to hear concrete examples of programs that are being implemented that have an effect. Victor, similar question for you. The president of the Dominican Republic has been a very strong supporter of addressing non-communicable diseases. And tell me, how important is it to have support from leadership from the top down, and in terms of integrating it into the healthcare landscape for the country?
Thanks. First of all, hi to all, salute to all. I think it's extremely important to sit here and see the devastating effects on the second Global Hypertension Report, but also the most important thing is that to see that we can optimize things to control it and achieve it. The President, since I started as a minister in 2024, he declared hypertension control and NCDs a state policy, and he assumed a program in where he dedicated a budget, a committed budget to that program. And we adopted the HEARTS program, and we named it, we gave it our own name. It's called Más Salud y Más Esperanza de Vida, that in our country means more health and life expectancy. And through that, we looked at the most vulnerable people. It was about 1.2, 1.4 million of Dominicans that have diabetes and hypertension, and we addressed the issue of controlling them and giving them a program. That program included free medication for all, free state-of-the-art medication. We changed the list of medications, essential list of medications of our country. I included the last state-of-the-art medications. We included also combined pills, and we also included the follow-up with the cardiometabolic control and cardiac clinic risks care. The President's motivation, he gave a starting speech, I remember, and say that to all of us, to all the country, that his first priority of the country was to increase life expectancy in his government for about 4 years more. I mean, from 75 to 78 years old, which is an extremely important goal, but it was only achievable if we control those NCDs which are the most common there. After that, after starting the program, we have achieved excellent results. We can say that by the end of 2024, we had already about 400,000 Dominicans included in the program. We have achieved already 66% control on those people that we are there. It does not only include medications, it also includes nutritional guidance. It also includes fitness exercise program. But one of the most important things is that we based ourselves in community and derived actions, and we didn't wait for them to come to us. We created a whole program to go to every little town and create all the services there. One, we include we saw the patients there. We include them in the primary care centers, and we created a record that we call in Spanish Pasaporte de Salud, which is a health passport. And through that passport, we give them a clinic every 3 months and control of the medication. This has led to recognitions, which I want to mention, because at the end, extremely important for people to be motivated in this sense. One of us, last year we won the NCD Task Force Award by the UN. This year we won the Excellence Organization in Hypertension Population by the World Hypertension League, which is also one of the main recognitions in this center. And the most important message that we can say is that we cannot wait for them to come also to us. We have to find them, look for them, and we went through all the databases of all the insurance policies, and we saw which patients have diabetes, which patients have hypertension, and we send them a communication and say, come to our clinics, and we're going to follow you, we're going to give you free medications, and we're going to make you better. And that's the main message here is that middle and low-income countries, if they achieve a strong political will, vision, if they work in association with communities, and also if we get strong help from international organizations like PAHO and OMS, we can also accelerate the control of this important disease.
Thank you, Victor. Gloria, the Philippines was highlighted in the report, in the WHO report, and your pilot program in your country showed a 6-fold increase in the percentage of people with hypertension who were able to get it under control, from 14% to 86%. Tell us a little bit about, in your opinion, what were the main ingredients to making that happen?
Okay, good morning, everyone. Well, yes, the Philippines Pilot Hypertension Control Program through the Healthy Hearts has achieved a 6-fold increase in blood pressure control, and this is through a combination of system-wide and patient-centered reforms. Now, these reforms include the following. First is a standardized hypertension care protocols which were implemented across primary care facilities. And this is using the WHO HEARTS technical package, which was integrated within our national Philippine essential NCD guidelines. So we call this the PhilPen. And by institutionalizing blood pressure screening, risk stratification, and standardized treatment protocols, we are ensuring that hypertension is detected early and managed effectively at the primary level of care. And these proven models are now being incorporated in our national frameworks. And starting this 2026, the updated PhilPen guidelines will be rolled out nationwide, and this is ensuring equitable access to evidence-based hypertension care. Then another one is a task sharing and capacity building of our frontline health workers. And we are talking about our community volunteer health workers. We call them barangay health workers, which provides the hypertension care in the community level. And they are really instrumental in reaching the underserved and remote population. Now, these dedicated workers play an essential role in raising awareness and then in conducting blood pressure screening and facilitating early detection and treatment referrals within the communities. Also, by mobilizing and strengthening their capacities, we were not only expanding the access to hypertension care, but also built a sustainable, people-centered model of care that is both cost-effective and scalable. And then third, the program invested in digital health interventions. We have the hypertension registry, e-registry, which was piloted and later integrated into our national electronic medical records in the hospitals and the iClinics for the rural health centers. This allowed real-time monitoring of patient outcomes, thereby enhancing accountability and the immediate interventions. This will be rolled out also nationwide, and to capture critical indicators such as blood pressure control rates, enabling data-driven decision-making. And finally, which is very important, this pilot project placed a strong emphasis on medication access, and of course, adherence support. Ensuring a steady supply of affordable and quality antihypertensive medicines proved critical in sustaining control rate. Of course, we know that there are limitations or barriers, like, for example, availability of resources, and then our health system's constraints. So in response, we have leveraged our universal health care, which guarantees coverage for essential hypertension services through PhilHealth, which is our national health insurance program. And recently, we have just increased the PhilHealth benefit package, and of course, a lot of people are benefiting from it. Now, furthermore, we coupled with community-level information and counseling, where healthier lifestyles through nutrition and physical activity programs, both in the schools and communities, were also strongly advocated. So it is a multifactorial, comprehensive, collaborative, and whole-of-system approach that has really helped a lot in improving or increasing our blood pressure control rates. And this is, as you have seen in our Healthy Hearts program. Thank you very much.
Thank you, Gloria. Now, Murti, less than 10% of the people living with hypertension in Indonesia have it under control. And yet I know the country is well aware and has the ingredients that it needs to change that number. Tell us, in your opinion, what are some of the biggest challenges to increasing that number of people with hypertension under control? Is it the awareness, the education, the surveillance, detection of those who do have hypertension, access to medication, all of the above? But which, in your view, are the highest priority for the country to address?
Thank you. Thank you, everyone. Good morning. Yes, Indonesia is dealing with these hypertensions. It's about 30% the adults has the hypertensions, and only about 46% are controlled and treated. And these, since we have these commitment with these preventions UN meetings last year, we did this quick win program, which is launched in February. We name it that this program is a free health checkup program. This free health checkup program aiming for the 280 million people in Indonesia. And until the end of this week, we have implemented about 31 million. And this was done by the 10,400 health center. And most of them, they went to the schools to have these free checkups, and the communities, and even they come to the health center itself. And Sadly, we have these hypertensions have the 5th biggest number from this screening program. So we at that time, and we are now trying to make these people have control their hypertensions with the we have this app from the phone. So after they have these screening, they know that they have the hypertension. So this is an early detection for them that they have to have this treated very well. And after that, we have these guidelines as well, as the Philippines have mentioned as well. We have these national guidelines, and we're now rolling up. And at least from these free checkup, we try to prevent all these hypertensions. And the other things is we have these now the policy about these nutrition grade. We're now expanding for the food in all the front of the pack of labeling. So we are now driving for behavior as well for the change of the public education from their foods. And that is the second things that we are trying to make this prevention from the hypertensions. And the other one is now we have these, everyone has the Satu Sehat, or we have the all mobile phones health check. So we can now, we have this individual actually medical record. So we know the treated, and we know how our health in this checkup. Well, it's not roll out in national yet, but we are trying now, starting, and we are really starting for the preventions. Thank you.
Thank you, Murti. I now want to turn to a subject that it seems to me for non-communicable diseases in general and hypertension in particular, we're seeing a shift toward really putting more power in the hands of the community and the patients. You know, is there a need for them to go to a clinic or a hospital or connect with a healthcare worker to get their blood pressure checked? And I think, Mekdes, you mentioned the impact of digital technology, right? And it seems like we're hearing in the Western part of the world about, you know, wearables, rings, watches, all kinds of devices that can really help people monitor their blood pressure on their own and give them alerts when things are happening. And in the case study that Dr. Frieden mentioned, you know, had that gentleman not had back pain, perhaps his hypertension may not have been diagnosed until it was too late. So I'd like to hear from each of you about, you know, whether this is also an important shift and an important way to increase awareness and detection of hypertension by really looking toward either technology or really shifting some of that responsibility, you know, from the healthcare system onto communities and you know, individuals to be able to have better ways to monitor blood pressure and to learn when things may be in the danger zone. Maybe you can start, Mekdes.
Thank you. I agree in the point that we have to bring healthcare closer to the user, and it has to be more closer to the patient. And when it comes to hypertension, there is no better way than bringing it more closer to the person, that the person really detects earlier, but we need to find the enablers. And the best way to find the enablers is in the technology, but it all depends on setups and settings. So we're trying with what we have recently with the Hypertension Control Initiative program that we have with Results to Save Life, plus the Hearts Initiative. Another thing that we added, in addition to changing guideline, adding our local manufacturing and other food procurement and other issues, the most important thing that was introduced is the innovation part, which you've said, which is usually common in many other countries, with bringing digitalization closer to the community, and that enabling the patient to detect earlier. And if their control is not within the period frame that you give them while they're at home, something has to really show them that they're not in the right track. So we have 160,000 patients now enrolled to the digital app that we have introduced, and within the health, primary healthcare facilities that I've introduced, they shouldn't be in the facility. But while they are already at home, if they have their BPs not controlled, they will log in their recordings over time, and the physician or the healthcare provider, and most importantly for us, our healthcare extension workers, can also, these are the primary healthcare providers, the community health workers, can also go to the patient or to the client, and they will tell them that their control within the period is not good, and they will also provide them with necessary tools. They will go through, is it more around diet? Is it about skipping their medication? And they will work on the details with their client. So this is an introduction that we have started, and it's the way forward for all of us. And another thing that we're also planning to do in our big digital health platform in the future is we have also community health information system, ECHIS, in our community. We have 28 million population who are already enrolled in this. So the next step for us is to scale up. And we will integrate what we have from the app to the digital platforms that we have. And the health extension worker, that community health worker, would use that data, and it would be a reminder for them to go and support the household. So this is how we are envisioning now, and when we are working in the scale up. So there is a possibility. There are tried ways. The community has ways to really work around it, but the next step is going to be, how do we do this, and how we come together? How can we come together? So if I don't get the stage next, I want to still thank both Resolve to Save Life, Bloomberg, and WHO, and everyone who has been partnering with us in this great initiative. But we just started, so we need to scale up now, and that is possible. Thank you.
Thank you. Victor, would love to hear your thoughts on that, and what role or impact you see, really being able to get more into the community and have individuals in the community take more power over things like measuring their blood pressure.
I believe that one of the most important things is to understand that primary care is about prevention, and prevention is the main form of primary care. And since I started ministry on January 2024, I took that as a mission. I remember sitting with Dr. Barbosa in September last year at Washington and becoming the first country signing the Global Alliance for Partnership for Primary Care with the World Health Bank, the IDB, and OMS. And it's an understanding of knowing that not a single disease can conquer primary care. That is the vision of integrating patient-based care into every one of the actions that we do. So any disease, working with the community can become a gateway, an important gateway to control and achieve those goals. And we look at those in every way. Every time we receive a patient, and the patient comes for one reason, we don't stop at looking the patients and the community for that reason. We start looking for the ones that could be there, and we start looking for the other ones that can be prevented. And from there on, we keep on going. And community and centered work can only be achieved through capacitation and protocolarization of our nurses, doctors, curricula. And we have achieved that also by creating about 20,000 doctors and nurses program, capacitating them. And we understood that only through community and civic center action, those actions could be optimized furthermore, and we could expedite results. I strongly believe that the only way that primary care can be established in all it's through an action in communities and in the society itself. And prevention through dietary measures. We are going to introduce for the first time in our country the frontal labeling system as well, with the help of PAHO, and empowering the communities to become part of the disease control is one of the main parts of our action in the country. Once again, not a single disease can give you the conquer of prevention, but they can become a gateway to other diseases and to conquer. The most important thing is that the integral care of patients and the solution not only to health issues, but also to the huge economical burden that we have on the health policies. Thanks so much.
Thank you, Victor. Gloria, I'm curious to hear about in the Philippines, this rethinking of the partnership and the connection between the community and patients and the healthcare system. It's often been always thought that patients need to come to the healthcare system, need to get engaged, but especially for things like hypertension, this is something that people could be monitoring at home and taking more responsibility for. Tell us about how likely that is and whether that's a realistic strategy for increasing adherence and awareness of hypertension in the Philippines.
Yes. Well, I have already mentioned the mobilization of our community volunteer health workers, because they really play a very important role in controlling this NCDs, especially high blood pressure. And then, of course, to involve these community volunteer health workers, it is very important that we really involve also all the other stakeholders, like, of course, the government, both national and local government, the private sector, and then also the civil societies, because it is with the collaboration of all these stakeholders that we can really have success. And then I would just like also to emphasize the importance of success, of political commitment and local leadership. That really matters a lot, because in the Philippines, we are in a devolved setup, so we really have to involve the local government, especially the local chief executives, the mayors, the governor in this program, and they are the ones to champion the NCD programs in the community to really ensure that there is community participation and to make sure the sustainability of availability of resources within their area. So these are very important, aside from, of course, what I mentioned about our Philippine guidelines as to guide the implementation of the project, and then the use of e-registry for our hypertensive cases. Okay, so these are all incorporated in our project, which we call the protection suppression. Okay, this is our national hypertension control program that we have initiated, and we hope that it will be in full blast. Of course, based on the success of our Healthy Hearts project. So we are now scaling up the coverage areas. When we started only with 17 LGUs and in one province, and then now we are already implementing it in 194 local government units in 2 regions. So next year we'll be implementing it nationwide, hopefully. Okay, thank you very much.
Thank you, Gloria. Murti, same question for you. I'd like to ask you about, we've heard Dr. Tedros talk about one of the lessons coming out of the report is the importance of community engagement. And with hypertension, again, as we've been hearing, this is an area where I think the population, the community can really get more involved, because the equipment, the monitoring, the measurement is relatively, it's non-invasive and it's relatively inexpensive. How important is that to incorporate that so that we're not overburdening the healthcare system and really finding this new avenue for increasing access and awareness about a condition like hypertension?
Since we have just told that the free checkup is implementing in Indonesia, and now Indonesia have these apps. We call it Satu Sehat. It's One Health, and most of the people who have these apps has these informations how their health, and from this free checkup, they have to. There's an alert system. They have to come back to the health center to have these free access for their medicines. And they have to come back to the health center to have this control program and education. So, and this equipment this app is now, we built this last 2 years, and now it's getting, the populations now have these apps more and more, and they seems that this app is more important for them because they know how their health is. And about the access of the medicines, of course, we have these the social insurance. They have these free medicines in the health center for these hypertensions, and now we are delivering to the 10,400 all the equipments. For most of them are EKG, ECGs, and these hypertension equipment. So in any time, the populations of Indonesians, they have the access to the health center. So we're hoping that 280 million people of Indonesians has these preventions program through this free medical checkup.
Thank you very much, Murti. I want to thank our speakers. This was really very informative and inspiring to hear about programs and ways that we can move from theory into action. So thank you very much. It's now my pleasure to invite to the stage Dr. Yarbas Barbosa da Silva, Director of the Pan American Health Organization, to give us some closing remarks.
Good morning. It was really a wonderful event. I think that's so important. Listen from the leadership of WHO, of Resolve to Save Lives, Bloomberg Philanthropies, but also to hear from the ministries of health the challenges and the achievements that they are doing. Esteemed Excellence, distinguished colleagues, dear friends, it's a great honor to participate in this event. I warmly acknowledge the organizers, Resolve to Save Lives, Bloomberg Philanthropies, and the World Health Organization, who have convened this important event. The second global report on hypertension reaffirms what we already know. Hypertension remains the world's deadliest, yet most eminently manageable health threat. Globally, more than 1.4 billion people live with hypertension, yet only 1 in 5 has their blood pressure effectively controlled. Behind these figures are millions of preventable strokes, heart attacks, cases of kidney failure and dementia, as well as disabilities and premature deaths, all leading to enormous social and economic costs. Yet successful interventions are possible, and they are already happening. Countries that prioritize hypertension control and adopt strong public health policies, such as eliminating industrial trans fat, reducing salt intake, and implementing the WHO Framework Convention on Tobacco Control, are making progress. Additionally, by strengthening primary health care through standardized clinical pathways, ensuring access to validated blood pressure devices and essential medicines, promoting team-based care, and using effective monitoring systems, countries are achieving higher hypertension control rates, building stronger health systems and saving lives. The prevention and control of non-communicable diseases, and hypertension in particular, are central to the mission of the Pan American Health Organization. Through Hearts in the Americas, PAHO and our member states have implemented the WHO Global Hearts Initiative in more countries than any other region. Today, 33 countries in the Americas are committed to Hearts, with 28 actively implementing the initiative. 12 of these countries are implementing the initiative in over 80% of their primary health care networks, and more than 10,000 primary care facilities are participating. As a result, over 6 million people are receiving hypertension treatment and 60% achieving blood pressure control. Importantly, 1.5 million health workers have been trained and certified in Hearts through the PAHO Virtual Campus for Public Health. Hearts shows that the evidence can be translated into large-scale action by simplifying clinical decisions, improving continuity of care, enabling task sharing, and ensuring reliable access to medicines and validated devices. Beyond improving hypertension outcomes, Hearts is also transforming how countries manage cardiovascular, kidney, and metabolic diseases. In Cuba and El Salvador, Hearts has been a catalyst for primary health care transformation. In the Dominican Republic that we listened, the Minister, Víctor Atallah, and I want to thank him for his leadership in the country. In his country, more than 4 million people benefit from free hypertension and diabetes treatment. In Chile, trained pharmacists and nurses manage patients following the Hearts clinical pathway based on a task shift model. In Ecuador, Hearts training has been adopted as a national strategy. These achievements demonstrate that tools work and give us confidence that we can accelerate progress in hypertension control and the management of non-communicable diseases even further. With only 5 years left to achieve the SDGs of reducing NCD premature mortality by 1/3, it is critical to accelerate proven NCD management intervention in primary care. PAHO is building on the success of Hearts to scale up the comprehensive Better Care for NCDs initiative. Together with WHO Resolve to Save Lives, Bloomberg, Philanthropies, and our partners, we are committed to support countries in the Americas to institutionalize Hearts as the standard model for hypertension and cardio-renal metabolic risk management. Through the PAHO's Strategic Fund, a pooled procurement mechanism that we have for strategic public health supplies, we also support countries to forecast demand and secure quality-assured medicines and technologies at competitive prices. We know the cost of inaction. Millions of lives lost prematurely to preventable diseases. The evidence is clear, the tools are proven, and we must act with urgency, equity, and solidarity to ensure that we achieve the global target for NCDs, leaving no one behind. Let us leave this meeting not only with heightened awareness, but with a renewed commitment to make hypertension control the cornerstone of stronger primary health care as we advance toward universal health and healthier society. I want to thank the panelists, the Minister of Ethiopia, the representative from Indonesia, our Minister from Dominican Republic. I think that it was very important to learn with your examples that can inspire all the countries in the world to move forward and to control hypertension. Thank you very much.
Thank you, Dr. Barbosa. Thank you, everyone, for joining us this morning. I also want to thank our hosts and our wonderful panelists. And as I said at the start, I hope that each of us leaves with more insight into how we can contribute to addressing a manageable and preventable condition, hypertension. Thanks very much, and I think you'll see on the screens the QR code to join the call for action and read the WHO report. Thank you, everyone.